Hello everyone, my name is Filip Pasler, Director of International Patients at KCM Hospital in Poland. I have the pleasure to sit here today with Dr. Kowalski. Dr. Kowalski is head of our bariatric surgery department, weight loss surgery department, and we are interested to hear a little bit more about you, about your medical history, how you decided to be a surgeon, and how you became a very famous surgeon.
I must start my history with the surgery in the 1994, and from the start it was the laparoscopy. For me, the surgery, mini invasive surgery like the laparoscopic surgery, is the very important, not only for me, for the patients. My first operation was in my surgery job was the cholecystectomy from the start, and now something of 10 years I interested in the bariatric surgery. And this is my very good interest in this part of surgery.
Tell us, one thing that patients always ask is, what is the age, from when can we start having weight loss surgery, and what is the age limit?
Mm-hmm. In age element in the bariatric surgery or oral surgery?
In bariatric surgery.
Bariatric surgery. We must remember that the bariatric surgery is the very specific part of the surgery, because this is all of the bariatric procedure. It doesn't matter. This is the sleeve resection, this is the bypass, mini bypass, this is the application, or for example, SADI procedures. This is the chance for patients. This is the chance to change your life. This is not only, we know that the sleeve and other procedures do what we want to do with the patient, but if obesity, this is not only problem in here, in abdomen. Okay. This is more complicated, and the patients must remember about this, that we proposed by the bariatric procedure, surgical procedure, to change your life.
The attitude, the lifestyle, a complex change.
Indeed. Diet, more moving, this is very important for this patient, because some of these patients it happened, come to the revision procedure. But this is something about 20% or more.
Mm-hmm. And tell us, just out of curiosity, what is the biggest patient you ever operated?
In my practice, it was the patient in kilograms, of course, not in stones. 248 kilograms. Mm-hmm. He was the 29 years old, and the most younger patient, which the weight was the 198. It was the patient 15 years old.
Wow. Right, thank you. And how would you tell us about the latest trends in weight loss surgery, in bariatric surgery? What are the trends in modern weight loss surgery? Are there some procedures, maybe the application or maybe another procedure that nowadays surgeons are trying to implement and learn more about?
I think it will be changed, but for now, the more popular procedure, and I think the very good procedure, is the sleeve resection. Of course, some of the part of the Europe and the United States, for example, the Benelux countries, a lot of bariatric procedure, this is the bypass procedure. But when we talk about this with the specialists, with the colleagues, bariatric colleagues, we know that after the bypass, we've got the problem with the patient for the revision procedure, because after the bypass we can't do the satisfied revision procedure. After the sleeve, which give for the patient very, very good effects, we can to do something. For example, we can to change sleeve to the bypass, to the mini bypass. For example, when we talk about the trends, the more and more popular procedure will be, I think, the SAVI procedure.
Tell us, how many bariatric procedures have you performed? Gastric sleeves, bypasses, revisions, all together throughout your career?
I really don't know, but I think that something about over the 2,000 bariatric procedure, with, of course, revisional procedures.
For patients around the world?
Yeah, indeed.
Fantastic. Thank you very much for the doctor's interview here at KCM.